Differential diagnosis of undescended testis. This actually differential diagnosis of cryptorchidism. What is meant by cryptorchidism? Cryptor means hidden. Chidism means testis. Therefore, differential diagnosis of undescended testis is also differential diagnosis of absent testis from the scrotum. If there is no testis in the scrotum, it is called cryptorchidism. Absent testis from the scrotum may be undescended testis or this. What is this? Ectopic testis, or other causes will be mentioned later on. Now, what is the differential diagnosis between inguinal ectopic testis and inguinal undescended testis? Both are inguinal, but the ectopic testis in the subcutaneous region, in subcutaneous tissue of the inguinal region, while inguinal undescended testis inside the inguinal canal. Therefore, the main difference here is the ectopic testis is superficial to the external abdominal oblique, while undescended testis inside the inguinal canal is deep to the external abdominal oblique. Therefore, if you ask the patient to contract the muscles of the anterior abdominal wall, one testis become more prominent and the other testis becomes more hidden and less prominent. We all know that any structure superficial to the muscle, if the muscle contracts, the structure becomes more prominent or the swelling becomes more prominent, which is ectopic testis. Ectopic testis become more prominent by contraction of muscles of the anterior abdominal wall, while undescended testis is deep to the muscle, deep to external abdominal oblique. Therefore, contraction of the muscle, the swelling or the testis becomes more hidden and disappear. Another difference between ectopic inguinal testis and inguinal undescended testis is this is ectopic testis. Try to push this testis upward. You can push this testis upward? Never. But can you push this testis downward? Yes. Therefore, ectopic testis cannot be pushed upward, but can be pushed downward. In contrast to undescended testis, undescended testis, the spermatic cord is short. In undescended testis, the testis arrest, example here, in the inguinal region, in the inguinal canal, with short spermatic cord. If the short spermatic cord and short vessels, you can push the undescended testis upward towards the short vessels. Never you can push undescended testis downward to the scrotum. This is the main difference between inguinal ectopic and inguinal undescended testis. The third cause for cryptorchidism is retractile testis. What you mean by retractile testis? Retractile testis is the commonest cause for cryptorchidism in early infancy and childhood. due to strong contraction of dartos and the cremasteric muscle. In this age, the cremasteric muscle and dartos muscle contract strongly, leading to elevation of the testis upward in the neck of the scrotum. And this usually disappear at puberty. What is the difference between undescended testis and retractile testis? Retractile testis in hot weather descend in the scrotum, but in cold weather ascend upward in the neck of the scrotum, and the scrotum become empty. Therefore, the scrotum is well developed or not. Testes descend and elevate from the scrotum. Therefore, in retractile testis, the scrotum is well developed, while in undescended testis, the scrotum is not developed. If you grasp the testis, you can push retractile testis downward to the bottom of the scrotum because it has a normal spermatic cord and normal vessels, while in undescended testis we will never pull the testis to the bottom of the scrotum as it has a short spermatic cord and vessel. And the squatting position. What is the squatting position? In this position there is increased intra-abdominal pressure. This position is called the squatting position, and in this position there is increased intra-abdominal pressure. Increased intra-abdominal pressure will push the retractile testis into the bottom of the scrotum, while in undescended testis squatting position has no effect. Therefore, there are three main causes for cryptorchidism, which means testis not present in the scrotum: undescended, retractile testis, and ectopic testis, and testicular agenesis. Agenesis means formation. Agenesis means both testes are not developed, or maybe one testis will not be developed. Testicular atrophy. Example after mumps. Orchitis in mumps destroys the testis and testicular atrophy. Or very, very rarely, hermaphroditism. What is hermaphroditism? Hermaphroditism should be excluded in bilateral undescended testis. In bilateral undescended testis, there is disfigurement of the external genitalia, and very rarely this disfigurement may be due to hermaphroditism, in which a person containing both testis and ovaries, male and female sex organs. This should be differentiated in case of bilateral undescended testis. There is a term called imperfect descent of the testis. Imperfect descent of the testis include the three main causes of absent testis in the scrotum, which is undescended, ectopic, and retractile testis. All these cases, the three cases, are called the imperfect descent of the testis. What is the investigations for undescended testis? If the testis is low and palpable, there is no need for investigation. Actually, we need investigation in high impalpable testis. High testis means high inguinal or abdominal. High inguinal mean in the internal inguinal ring. This testis in the internal inguinal ring cannot be felt, or abdominal testis cannot be felt. Therefore, we need abdominal ultrasound and CT scan. And the gold standard in abdominal impalpable testis is diagnostic and therapeutic laparoscopy. Diagnostic laparoscopy to see the testis. And once you see the testis and diagnose the site of the testis, continue as operation for descent and the fixation of the testis. Therefore, laparoscopy in this case will be diagnostic therapeutic laparoscopy. This is the golden rule in treatment and investigation for abdominal testis. Treatment of undescended testis. Treatment of undescended testis. Surgery is the main line of treatment, with two exceptions. What is the exception? In the first 6 months. In the first 6 months of life, just after birth, in newly born, if you see undescended testis, the best is to tell the mother we should wait for 6 months and just follow up of the patient, because during the first 6 months spontaneous descent of the testis may occur, and this is expected in low palpable testis. Since it is low in the neck of the scrotum or the external ring, give the testis a chance for 6 months, as spontaneous descent of the testis may occur to the bottom of the scrotum. This is the first exception to surgical treatment. You should wait for 6 months of life. And also in bilateral cases. In bilateral cases, the cause is usually hormonal deficiency, and therefore no surgery until hormonal treatment should be given to the patient. If fails to descend the testis, then surgical treatment. Therefore, surgical treatment is the main line of treatment, with two exceptions. In the first 6 months after birth, and in bilateral cases, hormonal treatment. If fails, no descent of testis after 6 months, no descent of testis in bilateral cases after hormonal treatment, surgery should be done. Also, surgery should be done if you suspect no descent of the testis. Who is very difficult to descend? High abdominal undescended testis. High abdominal undescended testis is very, very rare to descend. Therefore, surgical treatment is the main line of treatment. What is the age of treatment of this patient? The age of treatment of this patient from 6 months to 12 months after birth. Why? To preserve normal development of the testis and to protect the testis from irreversible histological changes which may be start at the 12 months. And if histological changes start, it will progress and they never return to the normal. Therefore, the best time for treatment from 6 to 12 months after birth. What is the method? The method of treatment is according to the level of the undescended testis. In low, palpable undescended testis. Low means in the inguinal region, external ring, or in the neck of the scrotum. The treatment is operation called inguinal orchidopexy or orchiopexy. And we mentioned in the previous video that orchio means testis, pexy means fixation. Through inguinal incision, herniotomy is done. We said before, undescended testis associated with oblique inguinal hernia, congenital oblique inguinal hernia in 80% of cases. Therefore, if there is hernia, herniotomy should be done, followed by mobilization of the testis and the elongation of the spermatic cord. How to elongate the spermatic cord? We elongate the spermatic cord by division of any fibrous adhesions or any coverings obstruct the inguinal canal, or any small branches from the testicular vessels to the surrounding structure. Divide all adhesion, any septum in the inguinal canal, any obstructing agent in the way of the testis, dissect and elongate the testicular vessels and the vas by dissect and mobilize the spermatic cord and the testicular vessels from the surrounding structure, from the adherent peritoneum. And normally in anatomy, the testicular vessels take a wide curve to reach the internal inguinal ring. Dissect the blood vessels. Dissect the blood vessels to pass a straight course to give me a length in the spermatic cord and testicular vessels to reach the scrotum. Once you reach to the scrotum, here, fix the testis in the bottom of the scrotum in a pouch created between this, what is this layer? This is the outer layer of the scrotum, which is the skin. And what is this muscle lining the skin? The dartos muscle. Therefore, we create a pouch in the scrotum between the dartos muscle and the skin with fixation of the testis in the bottom of the scrotum, because the short vessels and the vas tend this testis to return to the undescended position before. Therefore, fix the testis in the bottom of the scrotum and make a pouch to prevent retraction and recurrence of undescended testis. Sure, before we put the testis in the scrotum, we should stretch the scrotum. Stretch the scrotum to create a space which can accommodate the testis. This is a treatment for low undescended testis. Through inguinal incision, we descend by the testis into the scrotum and fix the testis. But if it is high, impalpable, abdominal testis, this is very difficult. The golden standard is laparoscopic treatment. This is the most important nowadays. Rarely nowadays open orchidopex, but here there is difficulty to reach to the bottom of the scrotum. It is very difficult during operation to dissect the testis to reach to the bottom of the scrotum. What is solving a problem? They have to solve this problem. To solve this problem, we can do staged orchidopexy. What is staged orchidopexy? Descend the scrotum in a staging operation. The first stage, dissect the testis and the spermatic cord and the vessel maximum. We will find the example, the testis reach to the external inguinal ring. Fix the testis in the external inguinal ring. Now, and after 6 months, the tissue grow, the spermatic cord and the vessels grow, and we can, after 6 months, do another operation to dissect the testis and reach by the and the scrotum can be reached by this testis in the next operation. Therefore, step by step, this is staged orchidopexy or microvascular technique. What is the idea or principle of microvascular technique? This is a view to the posterior aspect of the anterior abdominal wall. This is the fascia transversalis. This is the anterior abdominal wall from inside the abdomen. From inside the abdomen, we will see the testicular vessels and the nearby vessels. These vessels is called inferior epigastric vessels. If the testicular vessels are short and we can't reach the scrotum by this testis, by microsurgical technique, divide the testicular vessels here. And by microsurgical technique, anastomose the testicular vessels to the inferior epigastric vessels. This will give you a lens to reach the scrotum by this testis. Or there is a technique called Flower-Stevens operation. Flower-Stevens operation, the idea of this operation depends on, in the spermatic cord there are testicular artery and artery to the vas and cremasteric artery. First of all, in this technique, Flower-Stevens operation is put a vascular clamp on the testicular vessels and look for the testis. If the color of the testis remain red, healthy, normal, what this mean? This means that distal to the clamp there is good anastomosis between the distal part of testicular vessels and the artery to the vas and cremasteric artery, and the nutrition of the testis is normal, even if you ligate the testicular vessels. Therefore, if there is good perfect anastomosis between testicular vessels and the artery to the vas mainly, and the cremasteric artery also, we can ligate and divide the testicular artery. Pull the testis downward to the bottom of the scrotum, and the testis now will depends on the anastomosis between distal part of testicular artery and the artery to the vas and the cremasteric artery. This is the principle of Flower-Stevens operation. Ligation and division of testicular artery, descent of the testis to the bottom of the scrotum, depending on the perfect anastomosis between testicular artery and the artery to the vas. Ligation and division of testicular artery, and put the testis in the bottom of the scrotum. It will supplied normally by the distal part of testicular through anastomosis with artery to the vas. Finally, orchidectomy. Orchidectomy is only done if the testis is completely destroyed and atrophic, provided if the other testis is normal. This is the indication of any orchidectomy. No orchidectomy if the other testis is not normal. If the other testis is normal, any man can live with only one testis, and if there is pathology, advanced pathology, atrophy, destruction of the testis, we can perform orchidectomy, or also called orchiectomy. Finally, beside the surgery, never forget observation in the first 6 months after birth, and never forget in bilateral cases hormonal treatment. We give human chorionic gonadotrophins 1,500 unit per square meter surface area of the body, intramuscular, for 4 weeks. Never repeat this course again. If you repeat this course again, precocious puberty for this infant will occur. This is the treatment of undescended testis. Thank you for good listening and good luck.